Thank you all for joining us to this Manuthera webinar session. My name is Vili Rahkonen. I'm here with Mr. Kevin Collet, who will be our trainer today. We are arranging this webinar together with our great partners, Scrip companies. Thank you for joining. Today's topic is to give you an introduction to this piece of art called Manuthera 242. I will tell you briefly behind the background behind the Manuthera 242 and why is it designed as it is and what kind of features it includes and so on. So the first model was launched back in 1991, and this model, the third generation, was launched in 2017, and since then it has been the best-selling manipulation and mobilization table in Europe. Altogether, we have sold this table to over 60 countries in these couple of years, and we are really proud and happy to represent it now to you in the US. It is referred as a most versatile treatment table in the world, and today we are going to give you some answers on why it is called that. In the beginning, I can give you just like 4 topics or reasons why I think it is the most versatile. Firstly, you can be more precise with your treatment and techniques because of the features and the natural movement that we get from the Manuthera. Second, you can be more sensitive, and it is easier for you to examine your patient and the tissues of the patient because the movement is so smooth and soft. And thirdly, I would say that the working with Manuthera is a lot less burdening for the practitioner, and this helps you to have energy both on the first and the last patient of the day. And fourthly, it is very pleasant and comfortable for the patients to be treated on Manuthera because of its natural movement and smooth operating. You can use the chat next to you for questions and comments. I will be answering your questions there. You can also see my email address in the description, where you can send private messages, and then there's a link to our learning hub where you can find also more content on how to utilize the table in your practice and what kind of techniques you can use and how to combine them and so on. But now I think it's time to give the stage to Mr. Collet, and he'll give you a nice demonstration. Thank you for joining, and please, stage is yours.
Thank you, Vili. Hello, everybody. Glad to see you today. I'm Kevin Collet. I'm an osteopath. I work in my clinic called Movement Clinic, and working with different kind of patients, younger and older patients, a lot of sportsmen and sportwomen, but also just normal people as us on a daily basis in my clinic. I also teach in our Metropolia Polytechnic in Helsinki, Finland, for mainly osteopathy school. I'm very glad to be here today. I've been working with lawyers since 2016 and as a trainer, and I've been in different places for different seminars, international seminars in different countries. Now we are having this through a webinar, maybe hopefully one day more in a practice in live situations. But today I'm going to show you some of my favorite techniques for examination and treatment on Manuthera 242. So first I will show you about how to use the basic functions. So to get the table high, you have a pedal here on this side, same on the other side. You have it here also at the head of the patient. What I like particularly on this function is that I get the table very high, so I'm able to work here And this is something I like to work on when I'm here working on the cervical spine here, first rib, upper thoracic. I can be very in a comfortable position. Now, second thing, for some techniques, you like to have the table pretty low, or maybe even because of your size, the size of the patient might also have an influence. So you might want to have the table low enough so that you can do some techniques. If you need more power and use your body weight, for example. For some manipulation in a sideline, in a lumbar roll position, for example, it might be needed to get the table very, very low. Now, something else I'm going to show you is how to use the tilt. So, for example, if I have a patient coming to the clinic with a very acute low back pain, and, well, basically the way to walk is very restricted, and you definitely want to avoid maybe bending of the back and moving in general. So a very nice way to get on the table is to get the table in a straight up position, get the patient to move on the table, and then bring the patient in a comfortable position. Now, my patient is ready already, so I won't put the table completely straight, but that's how I would do with an acute low back pain. Now, that was tilt up, and it happens with the pedal here in the lower part of the table. And of course, I can use tilt down. So in some techniques, when I want to use the gravity to get some traction here, some decompression here in the lumbar spine, or even in the thoracic spine, if I want to use here some movement here, maybe some bigger movement here in the thoracic spine, I get some traction, I get more space, so I'm really able to work deeper on the tissues and to get a very nice treatment on the spine and also on other structures, muscles, for example. So I can use tilt up, tilt down, tilt up. Actually, I might use it for some areas here in the thoracic spine, and to make this level a bit more straight, to make it easier for me. So in this area, I can work on the thoracic spine with the patient a bit more, with the upper part of the thoracic spine a bit higher. So from here, I could work with an adjustment here. And if I feel that in this area, I would need maybe to change a little the position, I can have a little of flexion here and a little of side bend, and hold it here, right? So now the table is in a fixed position. I'm gonna take my contact here, ask my patient to breathe in. So breathe in deep and breathe out there, and make my adjustment. So I can use it also in a static way, all right? So, well, this is basically for tilt up and tilt down, and we're gonna see now for the lumbar spine other ways to use these functions. For the lumbar spine, what I particularly like is that my patient is now able to relax. And this is something I could do maybe with the patient's sideline, carrying the knees, palpating the spine between the spinosus processes, and having some movement here, which actually is fine, but it's pretty heavy, and some patients are not really able to relax when they are sideline and they're like on the side of the table. And I can say it's also with some patients, it can be very heavy for myself as a practitioner. So to do my examination here, I will open the table, palpate here, and just use the movement of the table. So now I'm using flexion of the table and palpating here between the spinosus process to have a very precise examination at each level of the spine, lumbar spine here, which is the area now moving, so L5 to L1 and into flexion. I can work also into extension here, and of course I can change these techniques into mobilization techniques to work more into getting some movement if there is some restriction somewhere there. So this is for flexion. Now if I want to change a little my focus and not work so much on the examination, or not consider on the examination but work more on mobilization of the spine, I can bring the patient into a little of tilt down and drive here into flexion. And now I can focus here maybe more on soft tissues here, and I'm getting a very, very nice mobilization into flexion and some traction at the same time. I also have the traction function. We're going to have a look at it later on, but this is already a very nice way to start. All right, so I like to have a bit of flexion. Many patients feel a bit easier with a bit of flexion in their lumbar spine. So instead of having them completely in a straight position, I can have just a little here and keep this position. Now from here I can work on the area I want to. So just to make the position of the patient really more comfortable and the work easier for me. Now to do my examination again on the lumbar spine, I just did extension and flexion. Now if I want to work on side bend, I can do this from the same position here and check for the mobility here of the lumbar spine into side bend to the right. So I do this in a pretty neutral position, of course. When I use as a treatment technique, I can get a bit of flexion, a bit more if needed. It makes it a bit more comfortable, a little of tilt to get some space here, and I can work here on the soft tissues or to consider more joint level and make it a more mobilization technique. All right. Now, if I notice here on the left side of my patient, there's a bit of tension, and I notice that it's into flexion and there is a little restriction into side bend. Now from here, I can take both directions. So I will have flexion here and side bend. So basically I can have a circumduction of the whole lumbar area, lumbar pelvic area here. All right. Good. Now, our spine is designed in the lumbar area to work in different directions. We know that there is some flexion because the direction of the facet joint is that way, so there's a lot of flexion and extension. There's some side bend also, and there's some rotation. Now we know that there's not like 10 degrees of rotation every level here in between each vertebra, but we know that it's very important to have some good mobility into rotation on both sides and at each level, each segment. Now we also know that when you have a disc bulge, treatment with including light rotation, mobilization works very, very well. And my personal experience is also good in this direction. So again, for examination, I can do that from the same position here. So no need to change the position of my patient. I can do the same here. And if I notice that, for example, in the lumbosacral junction here on the L5 S1 area, if I have some restriction, I can work more on this area. So I would do that in that case on that side. And there's different ways to do that. Some people like to hold here and hold here. So using really body weight here. Personally, I like to have the table pretty low and grab on the other side of the table using my leg and my hand. So I'm not pulling anything, I'm just pushing on one way and the other to have a very nice way of a nice treatment here. So now I have a combination of joint mobility and soft tissue work, including movement. Right? Again, if I feel that, for example, if I would have a nerve entrapment with the foramen being pretty like tight and a nerve root which would be irritated, I could even use a bit of here side bend, maybe a bit of flexion, checking how my patient feels in this position, adapting the position to have a position without pain. And then I could work with maybe soft tissue. Maybe some people like to have dry kneeling in this position or some other work, some other techniques. All right, so that's a way to combine just not having movement, but just static position. All right, so that was for examination and treatment using different direction of movement in the lumbar spine. So we had flexion, extension, side bend, rotation, and then we combine flexion and side bend to have some circumduction here. Now, I'm going to now to speak more precisely about the lumbosacral junction. So I think it's a very, very important area. I often think about it as the basement of a high building. If you have a high building, which like 5, 12, 17, 7, well, that's 24 floor, and then you have a basement under the 24th floor, then you should have probably a good base. And if you have a base which is a bit like bent, well, you know it has an effect upward. So I think this lumbar junction is very important, and I showed you how to do the examination into flexion and side bend and rotation. Now, if we have some limitation of mobility in this area, of course we can use that way to treat and mobilization here. But what I particularly find useful is to use the drop technique. It's safe, it's easy, it's fast. It's easy for the patient to be relaxed. It doesn't last long. You don't have tension, like the patient feeling tension for the whole duration of the treatment. You can just do it once, maybe I use it once, twice, maybe 3 times. Sometimes it's very tight. But I feel it's very effective treatment and quick. Now about the drop technique, something to consider first before using a drop is knowing about the anatomy. We have the anatomy of the lumbosacral junction is related to the direction of the facet of the joint facets. So we know that we have a gliding of the facet on one side and on the other. Now our joints are not designed to have this kind of movement, which would be like completely anterior glide of the sacrum here, or the opposite. We know that we have a gliding here and we want to have a little of movement that way. Now, because this is physiological movement, the table is also designed to make this movement possible, to restore it in the lumbosacral junction. So basically the drop will be a combination of a little of anterior movement and inferior movement, because it's what we need to get movement to the lumbosacral junction. And it's very well tolerated by the patients. Here, so I'm going to use here the drop. I'm going to turn and I will have this movement of the table going inferior and anterior at the same time. I'm going to hold here on the sacrum. Very good hold on the sacrum. I'm going to use my body weight, ask my patient to breathe in deep and breathe out, and here. So I'm just using my body weight. It's very light for me, and I can use this technique, which is very physiological and very well correlated, exactly because if you think about the anatomy, it's what the body is designed for. So actually that's how we designed also the table. Now, sometimes you have one side which is more restricted in the lumbosacral junction. So maybe I would use a little of side bend here to one side and maybe a little of flexion. I could use a bit more tilt here. And then I would again use the drop here, there, and now make it just unilateral. So I'm working now on the right side here, and my patient breathing in, breathing out, and I would use exactly the same technique here. Right, so I can make it, left it open, let's close it. So I can use this bilaterally or unilaterally and combine it with other directions, side bending, maybe a bit of rotations. Sometimes you have some unilateral restriction on one side of the lumbosacral junction and SI joint. Sometimes you have on both. Sometimes you have more unilateral contour nutation, and I feel these techniques are very efficient for that. Now, we can work also with a bit of rotation. So this is really something which is, I think, very versatile, and you can use it in different direction of movements. Now, that was for the drop. Sometime when you have maybe a disc bulge or something needing maybe some degeneration changes, having for consequence irritation of a nerve root, and you would need some traction. Now, to use traction as a treatment, how to make it easy? You can use here the traction function, which is very, very easy and very powerful. I won't use a lot, even if you can really use a lot of tilt and a lot of flexion and get really a lot of traction. But it's so powerful though, so that basically you don't need that much usually here. Now from here, the table will move here into inferiorly here. So I'm just going to push here. I can hold here at the same time and get some traction. Is that comfortable? Yeah. Here, right? So that would be the traction. So tilt down, flexion here, and then the traction. Again, I can make it a bit more unilateral if I want, or even more unilateral here with a lot of lateral flexion if needed. And again, I can do the same from here using this traction to get more opening on one side. That would be, for example, if I have really nerve entrapment here with irritation on the right side and I need more space on that right side. So I would then open it, form an opening on that side using sideband to the other side. So these are some examples of how to use this traction function here. Now another way that I really like to use, I'm just checking I've closed here. Yeah. Now as you see, I have strap here and here. Now for a basic examination, usually I don't need that. But if I want to have decompression of the spine using the tilt, I have a good fixation of the pelvis here, good fixation here, and I can have some decompression here of the spine. I can use this as a static position and just wait here. I can combine this with movement of the lumbar spine, or as we're going to have a look in a few minutes for the thoracic spine. So for lumbar spine, again, I can have a bit of flexion, maybe a bit of side bend, or I can even stay in this position or add some movement in there. All right. So lumbar spine, we had a look at the examination, treatment technique using movement, using static position, lumbar sacral junction, using the drop, using the traction, or using spinal decompression here. Now I'm going to bring my patient a little bit in a more neutral position here, and I'm going to show you a few things about the thoracic spine. Now thoracic spine is an area that usually if you do examination, you might do it in a sitting position maybe, or then you just test for the how is the joint play, but just pushing and testing the elasticity kind of the movement, just pressing and or even sitting with using the movement. Now one way that I feel very comfortable with is doing my examination using movement here into side bend here on one side and on the other, and then also into flexion. So again, I can have different holds. I like to have this hold between the spinosus process. For more treatment purpose, I like to have more contact on the processus transverse, but that's my way to do it, and I know some people use different holds. Now, for treatment from this position, I've noticed that here it's a bit tight for on her. There's a tight segment here. So I could work, of course, in mobilization technique, but now I'm going to check if I use a bit of flexion, and then let's take a bit of side bend here. Then let's make the table a bit, let's take a bit more tilt actually up. I like to have a little bit of tilt up because it makes the plane here easier for me. I don't have to bend on one side. I feel this is a lot more precise and effective. So I could just hold the position here. Now I have some Side bend, a bit of flexion in the thoracic spine. I check the area again. Here, I take the contact with the hypotenar part of my hand here. Table a bit lower. Opposite side here. And from here, I can ask again my patient to breathe in, deep, and breathe out, deep. There, and do my impulse. All right? So I can use manipulation here, or I can continue to work on mobilization technique. Now, if I work on mobilization, nice way to do it is to have the table a bit higher and a bit of flexion and using the gravity. So from here, I can use a nice smooth way to do my mobilization. Now, this is more global mobilization. If I want to make it more specific to one particular segment, I can change my hold here and work more on one segment here unilaterally. All right, now if we think about the direction of the facets, again, the facets in the thoracic spine, they're not so in a sagittal plane, they're more in a frontal plane, making it possible to have side bend, a bit of rotation also, extension and flexion. So I have facet joints on one side and the other, and what I want is a gliding of the facets. Now, if we think about what's happening in the treatment, if the natural movement of the facet joint is a gliding, I want to make sure this gliding happens, and if it doesn't, I can restore it with different kind of techniques, using mobilization like that, working on soft tissue if needed, or manipulation. And if I do a HVLA technique, again, I might use a bit of side bend, lock it, as we just see, and using the direction of my hands to make the movement into a gliding position. Right, so this is way more physiological than just working, and well tolerated than just working on a posterior anterior compression kind of force. So very comfortable for the patient, very, very comfortable and well tolerated. And we know that when it's more comfortable, it also probably is more efficient for the patient. So this is for the thoracic spine, and something personally I haven't needed for my manipulations, but something you might want to use is the lock here. So this is named the total lock. So now I've lowered the table. Basically, I could really jump on the table. It's really, really sturdy. As I told you, it's not something I really need, because usually my treatment is, even if I do a manipulation, I feel the table is sturdy enough. But just to know, it's nice to know that if you really need it, to have a sturdy table, you can use the lock. You have one here, I have one here on the lower part, and this I may use, for example, even with my patient's sideline, and if I want to work on the subtalar joint in the foot, and I really want to have a sturdy table here, or maybe in some techniques you might have your weight also here on the table, so it's something you might want to use. There. Right, so I think that's about it for a short introduction on the thoracic spine, some ways to use movement or static position for your treatment, really making it, these are just ideas, really making it, creating new possibilities for you to do examination and treatment techniques. Now from here, if we started from lumbar and thoracic spine, I can keep on going up and check the cervico-thoracic junction from here. So from that position, again, I can do my examination here into side bend, there, one side or the other. Could work on soft tissues here at the same time. I could use some MET, muscle energy techniques, really a lot are used with maybe a patient you would not work with manipulation. You can use just contraction and relaxation. So muscle energy techniques, for example, is possible to do. Mobilization of the upper spine here, upper thoracic, is something I really like using, this movement here of the head, because when we're moving the head, basically we should have movement here also in the upper thoracic. So from here, I like to work on the upper thoracic here, using a bit of tilt or a bit of flexion to create some space here and to have a good treatment on the upper thoracic. Right, example again could work on the first rib here, using again the movement, inspiration of the patient, etc. Right? Why not, if you want to have a CT junction manipulation, you could use a little of side band, lock it here, there, maybe turn the head of the patient a little here, here, there, and then from here having your thrust and making it HVLA technique. Right. Good. Now I'm gonna ask you soon to come into a sideline position, so to turn toward me. First bring you into a more neutral position. Here. There. Right. Okay. Now from here, yeah, you can turn toward me. There. All right, yeah. Hands behind your neck to have a good, behind your head, under your head to have a good position. Right, you're comfortable? All right. Now, in some case, you cannot really have your patient in a prone position, or maybe you just want to work in a sideline position to have maybe manipulation of the lumbar area and to have some like lumbar roll technique. So for this lumbar roll technique, can you come a little lower in this direction? Yeah, perfect. Here. So let's go here, here. A bit of rotation there. Good. Can you extend your lower leg on the table? Yeah, perfect. Can lock it here. Can turn the pelvis, don't do anything. That's it. Now from here, that would be my basic position. And from here, sometime what you notice, you feel that, I'd like to have a bit of flexion, a bit more, but then you don't want the legs to fall off the table. So what I like to use is a bit of flexion here. I lock it, and I'm here already. So if I need, I can get a bit of flexion of the table. Just lock it. Flexion of the lumbar spine here. The table is in locked position. My patient is in a very stable position without the legs falling over there. Then my patient is more able to relax, and then I can work on my manipulation here. Again, what I feel comfortable with. I know some people like to use their leg here, and then you need to get the table very, very low, and here it's completely possible. So some ideas of how to use again these possibilities to make your manipulation more efficient and still very comfortable for the patient. Now from here, I think you can turn on your back, and I'd like to show you something about the neck for cervical spine. Some things I could use, for example, if I have a nerve root entrapment, and I would use some traction. So from here, in this position, there. One way I like to use, so this is going to be the movement here. Of course, I won't have that much in her cervical spine, but one way I really like to use is having a hold here under the occiput, kind of having a good lock of the position, good hold here under the chin, and then just going into traction here. This should be comfortable for the patient. and usually it is. It probably will relieve the pain if we have, for example, some nerve root in the spine, having some symptoms in the upper arm and upper limb here. If needed, again, I can take a bit of side bend, lock it to make it more specific on one side. So I have more opening now on the right side because of the side bend here. To make it more specific to the lower cervical spine, what I like to do is to have the table, no, I'm going back to a neutral position, yeah, and from here to have a little of flexion here, there, and from here I'm going to do my traction here, there. All right, so traction using a bit of flexion to make it more specific for the lower cervical, which is basically pretty common. Most of the time we don't have nerve root entrapment in the upper cervical, but more in the lower cervical, maybe C6, C7. There. Now from this position, can you come a bit lower? Thank you. Here, let's have a look at this arm. Can I just ask you to hold your arm just for a second? Now this here, I can change the angle and I can use this movement. This is what we're going to have a look at now. Here I have a locked position, and to open it I just lift here, and then I have a locked position here, and again I lift here and then I move. Now this I can also use lower, but for this technique I like to have it pretty high here. Now from here we have movement of at the glenohumeral joint here, and if you like, for example, to have some mobilization into an inferior glide, so humerus head moving on the glenoid here inferiorly, so we have rotation, but we know that to avoid some impingement in the supracranial space, we need a bit of gliding inferiorly. So from here, I could use also this movement, having a good contact on the humerus head here, and moving inferiorly and coming back. All right. Okay, now I'll make your position a bit more comfortable again. Let me see. There. All right. Okay, so these are some ideas for today. Different ways to use static position or movement, muscle energy technique, manipulation, soft tissue technique, fascial techniques. Just some ideas. Hopefully you got some good ideas and new ways to use the table.
Thank you, Kevin. It was really really nice and wholesome introduction to this Manuthera world, if you may. And thank you all for joining today. If you have any questions and or feedback to us, you can write us email. You will see my email there, and also the contact information to Scrip, our partner in the US. So any questions you may have, please contact us. And for future webinars, please give us feedback. And also, like I mentioned in the beginning, you can visit our Learning Hub. The link is in the description for more content, for more ideas on how to utilize the Manuthera. But for today, I think we're done, and thank you again for joining, and until next time, take care and thank you.
Bye-bye.